Hello, I'm Christopher Springman, and you're listening to NephTalk, a podcast series created with nephrologists in mind from Satellite Healthcare, a not-for-profit dialysis provider and clinical researcher with a special focus on home as the industry's home dialysis leader. California's Proposition 8, also known as Stop the Dangerous Dialysis Proposition, is firmly on the mind of our next guest, Hrant Jamgoshian, CEO of Dialysis Patient Citizens. Hrant is inspiring his membership to get out the vote, a no vote on Proposition 8. I reached this tireless patient advocate on FaceTime. Thank you, Hrant, for taking time today to discuss California Proposition 8, a controversial, to say the least, and very complicated ballot proposition. So I'll ask you the obvious question. You're 3,000 miles away in our nation's capital, so why have you and your nonprofit organization joined the fight?
One of the reasons we decided to get involved in this issue is exactly that. Because we are a patient organization, we conduct annual membership surveys. And this summer, when we asked our members to please tell us, which of the following ways best ensures high quality care for dialysis patients, number one response was educated and activated patients at 37%. So our members are the ones who have provided us with the feedback that if we really want to improve care, it's not by reducing the resources that are available for patients.
As you said, Dialysis Patient Citizens is a nationwide patient advocacy organization with a high percentage of members in California, where there are almost 70,000 dialysis patients, which is quite significant. So I imagine that patients, their family members, nephrologists have asked you for your point of view on Proposition 8. What do you tell folks?
One of the biggest concerns is the detrimental impact that we expect it will have both on patient access as well as on quality of care. When you take money out of the healthcare system, in fact, in this area where there are really vulnerable patients, and the margins in some of these facilities are so small that they could adversely impact overall outcomes. That's one of the main reasons that we've expressed strong concern and strong opposition to this flawed initiative. If you get into how it's drafted, 15% may sound like a healthy margin, but it excludes a lot of health professionals that provide much needed care for patients, whether it's the medical director at a facility, whether it's the clinical nurse coordinators, the social workers who help patients navigate insurance options. A lot of the additional folks who provide clinical support for patients are not included in this flawed proposal.
According to the San Francisco Chronicle, Proposition 8 is an example of a special interest group trying to obtain from the ballot box what it could not achieve through other means. In this case, the measure was initiated by a labor union, SEIU-UHW. So why did they come up with the idea for Proposition 8, and what do they hope to achieve?
The way that I think my board member described it is it's using patients as pawns to put pressure on the dialysis companies to unionize. If they haven't been able to convince the staff at facilities to unionize, to become union members, then by potentially putting pressure on the bottom line, but also on the dollars available to care for patients, it may adversely impact them. And that's really what it's all about.
What are your thoughts about the possibility that due to decreased revenues, that dialysis providers would be compelled to close clinics in lower income neighborhoods and in rural, underserved areas throughout California?
It's a huge concern for dialysis patient citizens. In fact, we're worried that they're among the patients, these vulnerable patients are among those who are going to be hurt worst. Where there are already issues when it comes to access. And I think it's also important to recognize just how adversely impacted minorities are when it comes to kidney disease. That Latinos and African Americans have a much higher incidence of kidney failure. And so we're obviously extremely concerned about how much of a devastating impact that this initiative could have on patient access and the quality of care patients receive.
I'd like to read a quote from Dr. Theodore Mazer, who's the president of the California Medical Association, who said, quote, "Missing even one appointment can be fatal for dialysis patients. By limiting access to dialysis care, this proposition jeopardizes patient lives." What are your thoughts about that?
Our president of our board has actually been on dialysis now for 43 years and has never missed a treatment. I think what people forget, it's not the end of your life to be on dialysis. It's the end of your kidney function. But you need to take care of yourself. You need that access to care. And I think what's really concerning is that California has some of the highest satisfaction, some of the highest quality of care in the country when it comes to dialysis care, and how that may be adversely impacted by this initiative.
Harant, you told Modern Healthcare that long delays for the approval of new dialysis facilities, as well as extremely high startup costs, discourage new centers from being opened. Once again, especially in rural communities where there may be fewer patients, making it more difficult to recoup initial costs. This is very significant, isn't it?
We've heard of facilities taking a year and a half, 2 years before they actually accept their first patient. And in fact, most facilities, need to go through that process and aren't able to take single Medicare patients. So you can imagine the startup costs that a lot of clinics have to undergo before they can go ahead and start to provide care to patients.
I'm very glad we're speaking today because very often the patient is the forgotten person. We're talking about labor unions and money and politics and startup costs. But I heard an interview with a dialysis patient the other day discussing Proposition 8, and her take was very straightforward and very honest. She said, look, dialysis is my life support system. 3 days a week for 4 hours. So maybe, just maybe, I can live long enough to see my kids graduate from high school. Or if I'm really lucky, I'll get a kidney from a living donor. And boy, am I working hard on that one, talking to everyone at my church, where I work, online. That is a very pragmatic way to view the world, but it's a life and death situation, isn't it?
Absolutely. And I think you summarized it quite well, some of the challenges that patients are facing. And I think that's one of the biggest things that gets lost. In fact, we've never gotten involved in any labor management issues in the past.
Oh, really?
In fact, we try to stay out of that. Our organization has not gotten involved prior to last year when a lot of these efforts, whether on the ballot initiative or other efforts by unions, decided to potentially put patients at risk. My board made the decision, make sure that we do no harm, that patients aren't adversely impacted by the ongoing battle between unions and management. As you said, when you go back to what really matters to patients, it's about making sure that they get that access to care so that, whether it's 3 times a week, or if they're doing dialysis at home and getting the support they need so that they can lead a good quality life. And without that care, the only alternative is a transplant or death. It's that simple.
I'd like to give you the last word. What would you like to say to voters in the state of California? What would you like to leave those folks with?
If you want to vote for patients, vote no on Proposition 8. That's it.
Our guest has been Harant Jamgoshan, the CEO of Dialysis Patient Citizens in Washington, D.C., our nation's capital. Harant, thank you so much for joining us today on NephTalk.
Well, thank you, Christopher. Take care.